Malaysia recorded 1,683 more COVID-19 infections on Friday, taking the country's total of confirmed cases past the 90,000 mark to 90,816. Health Director General Tan Sri Dr. Noor Hisham Abdullah said there were, however, no new deaths, keeping Malaysia's COVID-19 death toll at 432. 6 new COVID-19 clusters have been identified in Selangor, Sabah, Kuala Lumpur, Negeri Sembilan and Johor. 2 involve construction sites, which are the Lebo Construction Site Cluster and the Jalan Tengah Construction Site Cluster in Selangor and Kuala Lumpur, respectively. The Tembok Gajah and Utama Rini clusters were located in Johor. In Sabah, the Sugut cluster was identified in Penampang and Papar. In Negeri Sembilan, the Persiaran Heights cluster was found in Seremban. As for the active clusters, the most cases detected are the Jalan Harapan Prison Cluster with 235 cases, the Muda Construction Site Cluster with 74 cases, and the Tembok Cluster with 55 cases. The number of people with active COVID-19 infections in Malaysia is now 15,140. The country also discharged 1,214 COVID-19 patients, which means 75,244 people have recovered since the beginning of the pandemic in January. Currently, 106 patients are in intensive care, with 51 requiring ventilator support. Meanwhile, Dr. Noor Hisham said more than 1,000 healthcare workers have been infected with COVID-19 from the current third wave. A total of 1,359 or 76.7% of the total 1,771 cases involving healthcare workers, including 43 new cases reported on Friday, were from the current third wave alone. Nurses made up the most of these infections with 690 cases so far. A total of 587 cases were infections from the community, while 565 were from other healthcare workers. Around 150 cases were infections from unconfirmed COVID-19 patients. 280 healthcare workers are currently receiving treatment at hospitals and are in stable conditions, with the recovery rate of 84.2%, while 1,697 are under quarantine. Hospitals in the Klang Valley recorded the most cases, with Hospital Tengku Ampuan Rahimah HTAR topping the list at 54 cases. As of Thursday, 72 HTAR staff are currently under quarantine. In Serdang Hospital, 29 healthcare workers and 28 patients have also tested positive for COVID-19. Dr. Noor Hisham said the drastic increase is believed to have been linked to the increase in cases amongst the community. He added, however, that all cases in hospitals are controlled and healthcare services are not disrupted.